Hi, I'm Scott Preschel-Bell, and I lead the Injury Epidemiology, Surveillance, and Informatics Unit at the Division of Public Health in North Carolina. This video provides an introduction to publicly available information and content being produced by several key partners of the North Carolina Office of Violence Prevention, specifically the North Carolina Department of Health and Human Services, RTI International, UNC Chapel Hill Injury Prevention Research Center, and the North Carolina Public Health Association. This video is meant to provide a brief overview of the public health approach to community violence prevention, to define one particular strategy, namely Community Violence Intervention, CVI, and give some examples of CVI work underway in North Carolina. For more on why it is important to treat community violence as a public health issue, we turn to the North Carolina Department of Health and Human Services.
Hi, I'm Cody Kinsley, the North Carolina Secretary for Health and Human Services. Here at the Department of Health and Human Services, ensuring the health, safety, and well-being of all North Carolinians is our top priority. We collaborate closely with healthcare professionals, community leaders, and advocacy groups, local, state, and federal entities, and many other stakeholders to make this happen. Violence is one of the leading causes of death and injury among our communities. However, violence is predictable and preventable. We need a comprehensive rather than fragmented approach to reduce violence. The public health approach helps us do this. Violence and poor health outcomes are fundamentally driven by many of the same factors: lack of food, transportation, housing, and other basic needs. The public health approach uses data to guide and evaluate action, focuses on known risk factors that increase or decrease violence, addresses the key drivers of violence, which are the same that underlie most of our health disparities, and implements a multi-layered approach to address this violence. Utilizing this public health approach also acknowledges that violence has downstream and cyclical effects on individuals and communities, such as injuries, PTSD, risk of disease outcomes that are the result of chronic stress, and much more. Working together, we can ensure all North Carolinians have access to healthcare, social services, and other critical resources, improving community safety and ultimately saving lives.
Importantly, the public health approach to violence is not meant to replace the public safety approach. Rather, these two approaches are meant to work together and learn from one another. To hear more about this, we turn to the North Carolina Department of Public Safety.
Hello, I'm Eddie Buffalo, Secretary of the North Carolina Department of Public Safety. In my role, I oversee law enforcement agencies including the State Highway Patrol, Alcohol Law Enforcement, and the State Capitol Police, as well as the state's Department of Juvenile Justice and Delinquency Prevention and the North Carolina National Guard. When Governor Roy Cooper formed the first State Office of Violence Prevention and seated it within the Department of Public Safety, we understood that it would support a critical partnership between public health and public safety, a partnership that helps prevent violence in our communities and makes for a safer North Carolina. Law enforcement and public safety officials cannot address this important issue alone. It calls for a collaborative approach, and that's why our partnership with the Department of Health and Human Services is so essential. Together with DHHS, we're working to identify the root causes of violence and develop comprehensive responses that draw on the strengths of criminal justice, healthcare, social services, and economic support systems. We are committed to this partnership and look forward to the continued growth of the Office of Violence Prevention, as well as the expansion of community partnerships with those dedicated to this cause. I encourage all law enforcement professionals to consider how they might adopt similar collaborative approaches in their own communities. By joining forces with public health professionals, we can create a unified front against violence and build stronger and safer communities together.
In order to learn more about how we define community violence in North Carolina and what is being done to prevent it, we turn to state and local experts who work on the front lines.
Hello, my name is Philip Graham. I'm a principal scientist in RTI's health practice area. And for more than 30 years, I focused my career on evaluating community-based efforts to address and prevent substance use and violence, particularly community violence. But today, my task is to really start a discussion around community violence in North Carolina and what's been done about it. To help me with this, I'm joined by Ms. Sierra Scott, who is the Director of North Carolina's Office of Violence Prevention. Sierra, I am excited to have this opportunity to discuss this important issue for the state of North Carolina. But before we begin, I'd love for you to introduce yourself and really talk about what is happening in the Office of Violence Prevention.
Sure. Thank you, Philip. My name is Sierra Scott, and I am a public health practitioner trained in behavioral science and health education. Currently, I serve as the acting director for the North Carolina Office of Violence Prevention, which is housed within our Department of Public Safety. The office was established in March of 2023 through executive order by Governor Roy Cooper. When our office was established, we were tasked with working to prevent violence, harm from violence, and firearm misuse in the state of North Carolina. Right now, our office is focusing a lot of our efforts around addressing community violence and its intersections with firearm violence in our state. Philip, I know this is an area that you have a lot of experience working in, so if you don't mind, could you please let us know how you would define community violence?
Absolutely. We typically think of community violence as violence that takes place between people that are unrelated but socially connected to each other. And those social connections be formal, and such as groups or gang affiliations, or informal, where folks don't know each other at all or overlap in terms of social connections and ties. It is also not required that they know each other, and in fact, there's evidence that over the last couple of decades, there have been trends towards increased gun violence between unacquainted individuals. The most serious sort of community violence involves the use of guns or firearms, and it can be premeditated or unplanned, and it can be very targeted or take the form of drive-by shootings where there's clearly not identified target. But it also can take place in inner cities as well as rural communities. Research has shown that in most communities, a small handful of individuals are connected to most of the community violence perpetration and victimization that takes place. They often are victims or perpetrators, sometimes repeatedly, because of retaliation, which is also a key aspect of community violence. And this can lead to cycles of trauma and violence that often reverberates in specific communities, families, and neighborhoods. And that's a broad definition, but when I think of community violence, that's how I would define it.
Thank you. Yeah, that is great. I think that definition is spot on. And one thing that I'd add is that high rates of community violence are generally seen in communities that have a history of oppression, structural violence, and even neglect.
That's actually another great point. So now that we've actually defined what we mean by community violence, can you talk a little more about how the Office of Violence Prevention is addressing it?
Sure. I think one of our main goals is to understand how North Carolina communities are seeking to address community violence, and then to determine how we can best support them and what we can do to ensure that they are using strategies that are evidence-based and most likely to address the particular problems they're experiencing in their communities. One strategy that is of great interest right now, both nationally and in our state, is community violence intervention, or CVI. And Philip, as you know, over the past several years, the Department of Justice has invested millions of dollars in community violence intervention initiatives. And I know that the definition of CVI is evolving, but I'd love to hear, Philip, how you would define CVI.
You're correct. The definition of community violence intervention is evolving, but I think that's okay. This is because people have been working to reduce community violence through both healing strategies for as long as there's been violence. But I think in its simplest form, CVI encompasses neighbors and community members working with one another to stop people who are at high risk of violence from committing violent acts through peacekeeping and healing strategies, and rather than disciplinary or punitive actions.
Yeah, that is really helpful. That's a great definition. And here in North Carolina, there are a few different examples of what that looks like in our state currently. One example are hospital-based violence intervention programs where people with lived experience support hospital patients being treated for injuries that resulted from violence. The goal of these programs is to work to prevent re-injury and instances of retaliatory violence. Another example are street outreach programs. And these are programs that are based in community and led by people who have lived experience. And these programs strive to interrupt and de escalate instances of violence, prevent retaliatory violence, and also to encourage behavior change. And for some of our local communities, they also have local offices of violence prevention or offices of community safety that are working to support these different programs and to coordinate efforts across their city or county to ensure that all of the efforts in their local community are working in tandem and they're building an ecosystem that are all moving towards a shared goal of preventing violence.
That's great. And I want to thank you, Sierra, for coming over today to talk about community violence prevention efforts in North Carolina with us. We're excited what OVP is doing, and we look forward to learning more about all the cool things that are being done. So thank you again for coming and sharing.
Thank you.
Thanks for joining us today for this introductory discussion on community violence in North Carolina and what is being done to address it. To learn more about these partners and these efforts, scan this QR code. You'll be able to learn about these programs that are taking place close to you and be connected to others interested in preventing community violence. As additional resources become available, we will update this page to share what we have learned. Thanks again for joining us in this effort to keep North Carolina safe.